Welcome back. If you have allergies or just problem breathing, nasal surgery may be a way to find some relief that you may not have considered. And here to tell us more about the options and a way that you can even figure out if it may be a good option for you, we welcome UK facial, plastic, and reconstructive surgeon Dr. Amit Patel with a look at some of those options and even some testing that you can kind of do yourself, right, to see if it's an issue for you.
Absolutely. There's so many people that have trouble with chronic difficulty breathing through their nose. And in this part of the country, allergies just happen to be a pretty big underlying problem for that. And medication helps the majority of people that have problems with difficulty breathing through the nose. But there's also a significant number of individuals that don't get better with medication, or they got better with medication, and then over time they actually start having trouble breathing again. And in those individuals, usually the issue is actually structural support, where a couple things usually go wrong. As we age, Mother Nature kicks in just like everywhere else in the body, and things start to collapse or weaken, and you have collapse of your airway. Or, two, you've had a trauma, and it may be something when you're younger years, but it kind of gets better. Here, you can take a look in this picture here. I kind of take a look at stuff and look at the nose as though it's a tent. The outside structure of the nose, you can see where the upper third is really bone, and you can even pinch your nose and feel that it's pretty strong. It acts like a vault. And as you extend down to the middle and the lower part of the nose, it's compressible. It's made up of cartilage. Now, as you peel that away and take a look at the internal architecture of the nose, you can see you have two nostrils, the left side and the right side, and that's separated by a septum, and then you have turbinates. But you don't have much of an airway. You can see here at the bottom, where you take a look from below up, you can see as you add allergies, that gray area shrinks considerably. And then if you have a previous history of trauma, the airway actually shrinks even more to where you go very quickly from the normal airway down to next to nothing. And that can be a big problem for people. And
you were telling me with some of the patients, they may just be looking for a cosmetic procedure, they think, to correct something from an injury that happened earlier, but they actually find it can impact their breathing as well.
You're exactly right. The nose is one area of the body, or the face, where external aesthetic really influences the internal architecture, or one and the same, and so they're tied in and married together pretty tightly. And so someone coming in for a problem, for a bump on the nose or an irregularity, that may be the cause for their trouble breathing as well.
And right now we have, I'm interested to hear about this myself, the assessment you can do yourself to figure out what may be causing some of your problems?
Yeah. I do a series of tests, but these are two tests I perform in the office. And one thing I tell patients, just take your finger, put it on the cheek, and literally pull it to the side. And if it improves your breathing, that's usually a sign that you may have some of that inward collapse. The other option, or the other technique I say, is, take the tip of your finger, push up the tip of your nose, and that helps lift up those cartilages that I showed you in that first picture. And that's just a kind of a simple at-home test you can do. There's other things I do in the office, like an endoscope or a camera view, but this is a nice first step in figuring out if you have trouble with it.
Very interesting. Yeah. And if folks are interested in learning more, is this something they should approach with their allergist first? Can they be referred to your department, or how does that usually work?
Yeah, a lot of patients actually see their allergist or their primary care doctor first, and then if they're not getting better, they can come in, they call their office, or they're referred to our office, and they come in to see us. Yeah.
Well, very interesting look at what some people may overlook as an option or a cause of some of their problems. You can see there at the bottom of your screen the phone number for the Department of Facial, Plastic, and Reconstructive Surgery at UK. Thank you so much, Dr. Patel, for being with us.
Well, thank you for having me.
We will be right back with a check of your forecast. Unfortunately, we're not going to shake the chance of rain and storms. Meteorologist Mary Watson is up next with those details.